Here in the heart of rural Africa, in villages which have no electricity, no running water and no paved roads, someone has figured out how to win a battle in the war against AIDS. We've come all the way down to Kenya's Maasai country, to the foot of Mount Kilimanjaro. We're here to meet the people who figured a way out of Africa's medical catastrophe. We're looking forward to seeing something that works.
Well, we're really
something
excited.
That brings some hope.
Yeah, we're excited to take you around and let you see what we're doing here.
And what they're doing is amazing. In short, giving rural Africa 21st century health care. This is the brainchild of American philanthropist Anne Lurie, who is also a pediatric nurse.
And we are here from a long way away to hope that you all stay healthy.
She has planned and paid for this clinic and the labs and all the high-tech medical equipment that the poor in Africa can only dream of. Dr. Tobiko is one of the physicians here. How normal is it for a place in basically the middle of nowhere to have this kind of sophisticated health care?
It's unbelievable. I mean, it's really rare. Okay, I never thought you could have such a thing in the middle, as you say, in the middle of nowhere.
It's basically the best that money can buy.
Yeah.
And the news has spread like brush fire. Every day, men, women and children come in from the Maasai Plains to get appointments with the doctors.
Her last monitor shows that she has done very well on antiretrovirals.
Not only are they diagnosed, treated and given follow-up care, everything is free. And the doctors see everything from this old woman's scorpion bite to this man who has HIV. His blood is scanned by the latest machines, just like it would be in the best hospitals in America. But what makes this program really special is the outreach.
We don't just sit here and wait for patients. We go out there and get them, take the medications to their doorsteps, take even blood for investigations at their particular
At
homes.
their huts.
Yeah. Right. So what's new? What's new? Is anything that needs my attention?
After consulting with Dr. Tobiko, Agnes Lesikar collects the medicines and gets ready to take them out to her patients. Agnes is one of 16 community health workers who keep this project rolling. Every morning they pack up their medicines, check their bikes, suit up and prepare to hit the road. What is this incredible daily morning hive of activity?
Well, this is really the bit that saves lives.
Barry Coleman's mission in life is to make Africa's healthcare mobile. He runs an organization called Riders for Health, and he's teamed up with this clinic to provide the missing link, transport.
The entire continent of Africa is more or less grounded when it comes to health outreach, which is a pretty big problem when you think of the effort that goes into sending drugs, sending healthcare expertise, and it all doesn't reach the people who need it.
We rode along with Barry and Agnes as she made her way to her hut calls through sandy tracks and punishing terrain. First stop on these motorbike medical rounds is to check on 5-year-old Nanetia. She is HIV positive and she waits patiently with her grandmother in their primitive mud hut for Agnes to bring them the latest in life-saving drugs. So you're going to get the medicine out of this travelling store case? Agnes has also come to give this Maasai grandmother an important medical exam to see whether she's learned how to prepare Nanetia's medicine. Agnes, what are you doing? Why are you making a mark?
I mark first the mark of which she has to make the solution, and then she put the capsule, and then after diluting, she'll take 15 ml for the kid.
Skeptics often scoff that people like Grandma Nasuru can't master the AIDS routine, but she's about to prove them wrong. Step 1. Fill a massive syringe with 20 milliliters of water. Step 2. Dilute the medicine and mix the solution. Step 3. Measure out a 15 milliliter dose. She passes with flying colours and Nanetia is getting better.
She's taking medication well and the viral load has gone down.
Which means that that's good.
That's good, very good.
So her grandmother's doing an excellent job.
Yeah. Now she's improving.
If the mobile hospital wasn't here and the clinic wasn't here and Agnes and the doctors, how would she get any drugs?
I don't know what I would have done or where this clinic came from, but thank God it's here, because otherwise this little girl would be dead.
Barry, here we are in about as traditional and rural a setting as you can imagine. What is the secret to good health care here?
It's getting it here. But what's happening here is unusually that healthcare is being brought to this Boma, to this village, and that doesn't happen in most of Africa.
Thank you very much. Thank you. Thank you. Bye. And all your kids, bye. To see the difference it makes when drugs and medical care actually reach the people who need them, we made our next house call to 32-year-old Nkotekia. She's a mother who's HIV positive, but during her pregnancy, mobile health workers brought her complete ARV therapy, and that stopped the virus from passing to her newborn son. And to make sure little Kilelo never inherits the disease, he mustn't drink his mother's milk. That's why the clinic provides a regular supply of baby formula. Bringing healthcare to this far-flung hut has saved a child from AIDS and from becoming an orphan. Are you convinced now that you can beat AIDS?
Yes, we can do it.
And if AIDS can be corralled in Mbirikani in the Maasai country, where every day still passes much like it did centuries ago, why can't it be controlled in all of Africa? It's almost like a simple solution that works. It's not massively complex.
Most certainly not rocket science. But that's what they say about Africa. When nothing gets through, nothing works, people die. Oh, it's Africa. It's absolute rubbish. Of course it's not Africa. It's that we don't do it right, except in isolated cases like this one, and we better start doing it right, because people are just dying for absolutely no reason at all.
And can something like the Mbirikani project here, can that be replicated? Can we take this around the country, around Africa?
Yes, absolutely. Yes, yes, yes. We've got the ARVs, we've got the public health knowledge, we've got the transport that works here, we've got highly trained public health workers. There's no need to be ambivalent about that at all. Of course we can.